Prameya Health in association with TOTS to Teen Healthcare, headed by Dr. Anuradha. So we have a short video which talks about Prameya Health, and also Dr. Anuradha will give us a little insight about what TOTS and Teen is all about, healthcare is about. Thank you.
Music is not playing, I think. I can hear downstairs.
Sorry, there was some error so that you couldn't hear the background music. Well, that was about the programs which are done through Prameya, and I believe few of you are used to the sessions that are being conducted by Prameya. So now Dr. Sandhya Ravi will introduce you all about today's topic and further down discussion, and Dr. Anuradha will be giving insight about her clinic at the end of the session. Thank you.
Thank you, Manasa. Good afternoon, all of you, and a very warm welcome. Before we begin, may I request you all to mute your audios because there is some background disturbance. I don't know where it's happening. And whenever you want to ask a doubt, you can raise a hand, type your questions in the chat box, and after the session, we can answer those questions. So just to introduce the speakers, I am Dr. Sandhya Ravi. I'm a breast surgeon and also running Prameya Health, which is a supportive and a preventive care organization. So we see a lot of breast problems, right from breast abscesses to benign breast diseases and breast cancer. With me is Dr. Anuradha from TOTS and Teens, who's a pediatrician. She's an adolescent specialist and a confident parenting coach. And she runs her own clinic and also the TOTS to Teens Healthcare Center. And she will be telling us more about her center and the work that they do at the end of the session. Also with me today is Dr. Jyoti Menon, who's a senior gynecologist. She has, been very, very actively involved in the care of women, pregnant women, and the antenatal and the postnatal programs at a premier reproductive health institute in Bangalore. And we have Dr. Manasa, who is an Ayurvedic physician at Prameya Health with us. So moving on, why are we doing this program today? This is a month of Women's Day programs. So every year, we do a lot of women programs related to women's health. And we never consider breastfeeding or breast health during breastfeeding, during what we call lactation, as a very important aspect of breast care. So we thought with this program, all four of us who are so actively involved in taking care of patients who have just delivered, or the managing the newborns, etc., we thought it's very important for us to address this issue. So that is why we're doing this program. As we all know, some of you may be expecting babies, some of you may have newborns, some of you may be here just out of interest to understand what the right tips are about breastfeeding. The reason we're doing this is, although WHO has recommended, everyone knows, right? Not just WHO, everyone across the globe knows that it's most important to breastfeed our babies exclusively for the first 6 months. We know the importance of breastfeeding, and we know what benefits it has, or at least some of the benefits we know. Despite that, you'll be surprised that it's only less than 50% of people or babies who are actually having access to breast milk. So that's such a sad thing, because breastfeeding definitely improves the nutrition of the child. It makes the child more intelligent, and it makes the immunity much better. So the babies survive through the first year of birth without getting major infections, etc., which was very high in those days earlier on. And without really falling ill or going to the doctor, the baby can lead a very healthy first year of life. And also it has innumerable benefits to the mother as well. So that is the reason why we thought we should share this information and also have an interactive session with you all, so that you can hear from the experts about the right way to do this. So in our panel, so today, like I told you, I have Dr. Anuradha and Dr. Jyoti and Dr. Manasa. So let's hear from them. The first few days, as soon as you give birth to a baby, the first few days are absolutely delightful. It's very exciting for the family. It's very exciting for the new mother. Many of you would be longing to have a baby in your arms. But always there's this anxiety as well. Am I doing it right? Am I feeding the baby right? Am I giving the baby enough food? And to top it all, we have grandmothers who will always say the baby is hungry, you're not feeding enough, and things like that. So let's hear from Dr. Anuradha. Dr. Anu, can you please tell us, basically putting the baby to the breast itself is a technique that not many women are aware of. And, they always worried that, is the latching all right? How do I help with the, proper latching to the breast? How often should I feed during the day? And, how long should I feed, etc. Anu, Dr. Anu, can you please explain to us how this is done?
Thank you so much, Dr. Sandhya. And I'm truly excited because we are celebrating Women's Day in the coming week. And I'm really glad that we are addressing such an important topic to all the participants here, whether you are expecting a baby or you're already a mom. Breastfeeding is something which is really, really important. And we need all the help and support that we can get to make sure that we are able to breastfeed successfully. And that's the reason a lot of preparation is required when it comes to breastfeeding. Having said that, what happens is that, as soon as the baby is born, everybody tells you to breastfeed. But many times, I'm sure many of you moms would agree that you might be actually clueless when it comes to starting breastfeeding, because there isn't much thought which has gone into the process earlier. So in the first few days, very often when I look at mothers and I speak to them when the baby is born, so they all want to breastfeed, but they are more worried about, how much breast milk is coming. I haven't got a drop of milk. Now, when do I start breastfeeding? Should I wait for the milk to come? These are some of the questions which are running through your mind. And then to top it, there is lot of expectation from everybody around you to feed the right way. Now, what is the right thing to do? What's important for every new mom to understand is that it doesn't come just like that. So we need to take help when we are at the hospital from the nursing staff who is around us, from our family, to start this process. And when to start breastfeeding, you do not have to wait for the milk to start forming. It's actually the other way around. When you start feeding, the breast milk starts increasing. So generally, when to start means that you have to start soon after birth. The recommendations are that as soon as you have a normal delivery, even before you leave the labor room, within 30 minutes of birth, the baby has to get its first feed. And when it comes to a C-section, it has to happen within 2 hours of birth. Now, you might be wondering why this is important. There are two reasons. One, there are the bonding that happens when the baby starts feeding. There's no words to describe that. And second, when the baby starts sucking soon after birth, your brain gets a signal that, yes, now my breast has to produce milk for my baby to be satisfied. So it starts with actually starting the process and not waiting for the milk to come. So that's the first most important thing. Now, second, positioning is one thing which is very crucial. Of course, there's a lot of details of how to breastfeed and why position is very important. And there are various positions that we can follow in order to breastfeed successfully. They have some names as well. They are called cradle position, cross cradle position, lying down, football position. A lot of all this information is available. The most important thing what I would like to explain here is that whenever you are trying to feed the baby, when you are asking the baby to latch on, the first rule is that mother and baby need to be comfortable. Very often the mother is so uncomfortable, she's wearing so many clothes, there is no way positioning is happening properly. Why position is important is that when the baby starts sucking, most of the time mothers are worried, that the nipple size is small and it's big, and that's why the baby is not able to latch on. The truth is, it doesn't make any difference what the size of the breast or the nipple is. When the baby is trying to latch on, there is a black part which is there around the nipple, which is called the areola. So now when the baby is successfully latching on, it has to take in the nipple as well as this black part which is around the nipple as much as possible into its mouth. Then the reason for that is that the glands or the tubes which are carrying milk, they open there. And if the baby keeps sucking at the tip of the nipple, all you're going to end up is with cracked nipples, and the baby doesn't get anything. It gets frustrated and stops sucking. And that's where one of the first common reasons why actually latching and breastfeeding fails. So these are very small things, but they are very crucial to initiating breastfeeding. Now, why is it so important for a mom to understand that she has to start feeding immediately after birth and not wait for another 3-4 days for the milk to form? Is that in the first few days, the milk that is secreted. So I don't know if you're aware that breast milk actually changes from the time of birth over the next few weeks. So initially, what you get is, it looks very different. It doesn't look like breast milk at all. It is very small in quantity. It looks yellowish. It is thicker. And that is but a very, very important part of breast milk, because that's called colostrum. So we all talk about, breast milk being protective for the baby. And that happens if you do not waste even a drop of this colostrum. Everything that you need to protect your baby from cold, cough, from stomach infections, any other serious infections, all that is there in colostrum. So make sure that you do not waste even a drop of this. So in the first 4 days, it's really crucial that you give this. And as you start feeding, you will see that this colostrum changes, and the look and the feel and the consistency of the milk, everything changes over a period of time. So once we are aware that these things happen, so nature is beautiful, it has made breast milk in such a way that it is suited to the baby's developmental age. In the first few days, a couple of weeks after birth, and thereafter, every time, breast milk is something which is tailor-made for the baby. And there's nothing till today we have been able to discover which 100% matches that. That's the reason why it's so important for us to start breastfeeding early, learning how to position, how to be comfortable, and to make sure that the baby is latching properly. And very often, the problem is that when latching doesn't happen properly, you will get a lot of pain. And when breastfeeding is painful, it means that you are probably not doing it right. So breastfeeding is not a painful process. You will feel the sucking, but you should not feel pain. When the moment you start feeling pain, you need to check why. So these are some of the important tips, I think, Dr. Sandhya, which are very important in the initial
Yes,
few days
yeah,
after
absolutely.
lactation.
Yeah, thanks, Anu. That was really very useful.
So I think only one more thing which I would like to say is another common concern is, how much is my baby getting? Is my baby getting enough milk? How do I know? So normally, if a baby is a good weight baby and it is a full-term baby, in the initial days, there is enough there in the baby's body to sustain. So we are not in a hurry to give extra milk. When the baby cries, everybody panics because it's a new baby and a new experience. And they tend to give some extra milk and other things, which is not necessary at all. What is important is to frequently put the baby to breast. And in the first couple of days, if your baby has passed urine once or twice, or if it has passed motion, that's good enough. As the milk starts improving, how you can make out whether breast milk is enough or not is to count the number of times your baby is passing urine and motion. Now, if in the next few days, the baby starts putting out more urine, that means the intake is good. So you needn't panic, just count that. And the motion also changes from a blackish sticky color to green and then to yellow. These are some of the changes which will help you to understand that whatever you're doing, it's on the right track and your baby is getting enough breast milk. So thank you, Sandhya. You can.
Yeah, thanks, Anu. That was really a lot of useful information. So it's all very well, as soon as the baby is born, this breastfeeding happens and things like that. But many times we find that there are some problems that, suddenly we say, oh, didn't you tell your doctor when you were pregnant? Did nobody tell you that you had a problem with the nipples? So doesn't this preparation for breastfeeding actually start when the lady is pregnant, during the antenatal checkup? It is quite important to understand the preparatory process for breastfeeding after delivery, and this should begin much, much earlier during pregnancy. So let's listen to Dr. Jyoti and what she has to say about how we go about preparing for this.
Thank you, Dr. Sandhya. See, as an obstetrician, I have seen that it is very, very essential to do a clinical breast examination, preferably at the time they come in early pregnancy, and repeat it if you cannot do it every time, at least once in 3 months, what we call every trimester. Because the reason is different as to why you're doing the breast examination in each trimester. Initially, the whole idea is you have to look for a presence of any kind of lumps. Most importantly, also whether the nipple is flat or it has gone in, what we call the inverted nipple. And also on mild pressure, if there is any discharge. See, some amount of discharge which is colorless, which is little, is normal because of the increased levels of the hormone in pregnancy. But if the discharge becomes bloody, then you really need to definitely go and see your doctor. And here I want to emphasize, yes, the obstetrician is the one who has to do this examination. So maybe lots of people, a lot of obstetricians also may not be doing it. So you have every right to ask them these questions. And if you are intelligent or if you're knowledgeable enough, you can probably do this yourself to make sure that the nipple is okay. Then later on in pregnancy, as you come closer, it's again very important to make sure that the nipple is of the correct, is everted and not inverted. And if you do a gentle massage around the areola, especially as you're coming closer to delivery, then the milk glands, like Dr. Anu had mentioned about the areola, the black region around the real nipple, that area gets stimulated, and later on it helps in breastfeeding. So these things are very important, that breast examination as well as looking for all these problems, because if you have inverted nipples, it's very easy. They can always teach you to use a syringe to pull the nipples out, and many times we have seen that even that is not required. You should just be aware of it, because the minute the baby starts sucking, the nipples themselves will come out without any other further treatment required. But if it's really inverted or it's flat, it doesn't come out of the level of the breast at all, then these kind of measures initially will help you to have a successful lactation.
Yeah. Thanks, Jyoti. In fact, I've had patients coming to me for the second pregnancy. The first pregnancy, they had a very bad time with flat nipples and not being able to breastfeed adequately. And during the second pregnancy, they've come back and we've taught them how to help with nipple eversion, and also some in all my years of practice, maybe one case I have operated on to actually bring the nipple out. So these are things that you yourself can pay a lot of attention to during the pregnancy and make sure that you're ready for breastfeeding. Anu, one other aspects that we need to understand is many times, why is it said that you have to exclusively feed the baby for 6 months? Many times mothers, the family is anxious that there is not enough milk. So, they feel guilty about supplementing within the 6-month period. And also, how can we handle that situation? And, how do we address that issue?
Thank you, Sandhya, because this is really crucial, because this is a common problem that I've seen happen. And most of it comes from the anxiety that, and lack of awareness as to how long one should be breastfeeding and what is the meaning of exclusive breastfeeds. So let me just first explain what is it that we recommend and why we recommend it. So breastfeeding needs to be started soon after birth, and it can be continued for a period of 1.5 to 2 years. Of this period of breastfeeding, the first 6 months are what is known as exclusive breastfeeding. When we say exclusive breastfeeding, in the first 6 months of life, baby gets nothing other than breast milk for its growth, for its nutrition, for its survival. So the baby does not need extra water. It does not require cow's milk, sugar water, packet milk, any other formula or solids in the first 6 months of life. So this is the period of exclusive breastfeeds. And I'll come to why that is so important. Now, after the first 6 months, the mother doesn't stop feeding, but she continues to feed for the next 1.5 years. So that is what we recommend. Now, why do we ask you to do exclusive breastfeeding in the first 6 months? The one most important thing is that it is complete food for the baby. And that's the reason why baby does not require anything else. Everything that is required for physical, mental, psychological, emotional growth, everything is available in the breast milk. And that's the reason why we do not even start solid feeding in the first 6 months. And we will be talking about the benefits of breastfeeding a little later, and where I'll explain in detail to you why. But right at this point of time, it's important to understand that the first 6 months is a period of exclusive breastfeeds. And this is followed by continuing of breastfeeding along with complementary food that is introduced to the baby. Yes, it's true that there is a lot of anxiety around whether breast milk is sufficient for the baby or not. So one of the things, like I mentioned earlier, it's very important for you to stay in touch with your doctor and make sure that your baby is growing adequately. Now, what is the gold standard? How do we make out whether breast milk is sufficient? What is important to understand is that in the first 2 weeks of life, actually the baby loses a little weight, about 5 to 7% of its body weight at birth. So what happens is at the time of discharge, the baby may be weighing a little less, but this is a normal process. And then the baby starts gaining weight. In the first 3 months, if your baby is gaining roughly around 25 grams per day, which translates into around 800 to 900 grams per month in the first 3 months, if your baby is gaining this much weight, definitely your breast milk is adequate, because it can be really confusing for a new mother when she gets to hear from everybody, that baby is growing so well, that baby looks chubby, your baby looks thin. Well, each baby is unique and different and grows along a different growth trajectory, starts at a different place and ends up at a different place. So comparison is only going to give you heartache. So do not compare. That is the first rule. But stay in touch with your doctor, because that will give you the confidence that your baby is growing well. Having said that, it doesn't mean that you go to the doctor every day and check the baby's weight. That is going to be more stressful. What you need to do is, like I said earlier, ensure, is your baby passing enough urine? Check. If your baby is passing some 8 to 10 times or more times, they'll pass much more. Believe me. But if they pass at least about 8 to 10 times urine, how you can do this is also maybe for a day or two use a cloth diaper. Just count the number of diapers and put a tick. And you know that if you have changed the diapers, you have changed the cloth diaper at least 8 to 10 times in 24 hours, you can be really stress-free and say that, yes, my baby is getting enough milk. And also this will prevent you from unnecessarily giving other things and other milk, which actually reduces breast milk, because the moment the baby gets other thing, baby is going to take less from you. So the more frequently you feed, the better the milk output is. That is how it works. And this is really important to understand. There are very few situations where breast milk may be inadequate. And that again, you have to decide along with your doctor whether it is actually inadequate and what are the things you can do. And I'm sure we'll be hearing more from Dr. Manasa. There are a lot of other natural ways and other ways of enhancing breast milk without jumping and starting formula milk. So guilt is something every mom goes through because, the fear that, she's not doing enough and she's not producing enough milk. So understanding these basic things will really help you to stay stress-free and do exclusive breastfeeding.
Okay. Yeah, thanks, Anu. And this whole thing about, I have a lot of girls coming to me and saying, oh, and cesarean aitu, adike seri feed manakaglilla. I couldn't feed my baby well because I had a cesarean. So how do we reassure people that having a cesarean section is nothing to do with production of breast milk or actually feeding the baby?
Yeah, I think that's an important question, because even I get to hear this. I've had a cesarean and I have not eaten for the first, because like any surgery post cesarean, 24 hours the mother can't eat because they wait, and then but it has no connection whatsoever to your producing breast milk, and you don't have to wait to make the baby latch on. Irrespective of whether you've had a normal delivery or a C-section, breastfeeding does not change. You are given a little more time as far as cesarean is concerned to initiate breastfeeding, because it may take that much time for the procedure to get over. But as far as feeding is concerned, whether you had a normal delivery or a C-section, you will still continue to produce the same amount of milk, and that milk is adequate for your baby. It's not about somebody else or to compare with somebody, some other mother, but you will definitely be able to produce enough breast milk irrespective of the way you have delivered.
Thanks, Anu. So before we hear from Dr. Manasa about, routine breast care and what we can do about improving the quality, quantity of breast milk, etc., just wanted to check with Jyoti on how do we handle women who are on some medications. We do know, mothers could be taking anti-epileptic, anti-diabetic, antihypertensives. So how does that affect, breast milk production?
See, per se, it really does not affect whether you have diabetes in pregnancy or you have hypertension in pregnancy, like or the method of delivery, like Dr. Anu said. But if you are on certain medications which you feel are not included in this group, you need to check with your consultant obstetrician as to whether you can really breastfeed. But 99% of the time, regardless of anything you are on, breastfeeding is allowed in and is recommended in most of the conditions also. So you can go ahead and feed unless there is some real contraindication with which you can discuss with your obstetrician.
Yeah, and when we talk about it later on, the breast abscesses, sometimes we'll have to put you on antibiotics depending on the sensitivity of the organism which is causing the abscess. So even then, we take care to make sure that it is safe for the baby, the choice of the antibiotic. So your doctor is the best person to tell you if the medication is going to affect breastfeeding or not. And you need not have unnecessary fear and stop feeding just because you are on some medication.
So, Dr. Sandhya, can I just add one more thing to
Yeah,
that? That along with medication, even there are certain medical, even minor medical conditions where the mothers get very anxious, like if they have fever or cold and cough, whether they can feed or they can take medicines. Well, the answer to that is that even if you are suffering from these minor viral illnesses or you are on medication, you can still continue to breastfeed. You are not going to pass on that infection through breast milk. Most of these infections are airborne. So they are nothing to do with your feeding. So even when mother has fever, or we still ask mothers to continue to breastfeed if they are just some common cold and viral infections. They are not going to harm your baby in any way.
Anu, I just want to ask, if it is like that, do they need to wear a mask? Because the patients are very, very scared that the baby comes close to the thing. Maybe they have to be a little careful that they don't sneeze and cough over the baby.
Absolutely. I think wearing a mask is a great option. And we saw this throughout COVID, because even when mother was COVID positive, we never made them stop breastfeeding. Because the babies, the advantages of breastfeeding far outweigh the risks which are associated with the disease process itself. So we can follow other precautions like masks. That is really useful. Thank you, Dr. Jyoti, for that.
So now we come to the important topic of how to care for the breast, what to eat, etc. We come from a culture, our country especially, is so steeped in so many myths and not necessarily myths, many good points also revolving around motherhood, delivery, taking care of the newborn, breastfeeding, etc. And many times these are misinterpreted by the general population and they'll end up in problems. So, denying certain foods, denying water, etc. Patients end up with constipation and lots of other issues. So let's hear from Dr. Manasa, who's an Ayurvedic doctor, what she has to say about how to take care of the breasts during lactation and also the kind of food and liquids that you need to take. Over to you, Manasa.
Thank you, ma'am. I hope majority of you have heard, eat whatever you want in your pregnancy. Post-delivery, you can't eat this or you can't eat that, right? So it's not such a scary situation post-delivery, but it's a little delicate situation because 9 months your body would have undergone so much of changes for your body to restore and to take care of the new life what you have in your hands, the beautiful life you have in your hands, right? For that, few restrictions were framed, but as Sandhya ma'am mentioned, it's been altered and it's used the way each and as whims and fancies. So there is absolutely no restriction for water because many people say you're not supposed to drink water. See, generally when we talk in terms of Ayurveda, the water component will be little more in the body. So you can be, and other food, whatever is taken post delivery will be more of fluids. So if you are not thirsty, no need of water. If you are thirsty, if you have delivered in summer season, then definitely you need some water. So there is no restriction of water. Also at the same time, there is no mandation that you have to drink 3 liters or you have to drink 4 liters of water. Your tongue is the best indicator. If you are thirsty, please go ahead for and drink water as per the season. See, a little warm water will always aids in metabolism. Post delivery, the whole body metabolism would have come down. So a little warm water or never drink boiling water. So lukewarm water will help you to the aid, will help to aid the digestion. In case if it is a peak summer and it doesn't suit you, you can always go for boiled and cooled water or a purified water. The source depends on the source of water you have. And coming to the restriction of the diet, see, we say the ultimate of what you eat nourishes the baby, even when it's in the womb, when you have in your hand in the form of lactation. So it's ideal to eat a healthy one. I mean, whatever the food you eat, transform. So if you are eating something with so much of hatredness, I don't want to eat this, but I'm fed this all the 3 times, and you want to eat something else, but still you're scared. If I eat this, my baby will get cough. If I eat this, my baby will have colic. See, if you are not able to digest few food, definitely you will have some issue. So if you have some digestive issue, the end milk production may not be that smooth. So that's why few regional restrictions are there. So you have to use your common sense to decide whether you can go ahead for it or not. And again, as said, whatever you eat, the ultimate essence. So if you eat healthy, your baby and the quality of the lactation will be great. And few of the things what are made, the preparations made locally and given to the new mother. Next slide, Kirti, please. So they are generally based on the food which is available in that region, which are good for mother as well for baby. For example, there are n number of vegetable available, but most of us, we are very familiar with the sabbakki suppu or the dill leaves. That's given almost commonly in all regions because it boosts the quality as well as quantity of the lactation. Similarly, the gourd vegetable, it could be the bottle gourd or the ridge gourd. They are very nourishing for the mother as well for the baby. As said, it improves the quality and also the quantity of the lactation. Similarly, the sesame seeds, yellow. So that is very rich in calcium. And ginger. In few regions, they give ginger powder along with the jaggery. So ginger, it boosts the metabolism. And coming to methi or the fenugreek seeds, see, you have over the period of pregnancy, you would have accumulated so much of weight. At one point, even that weight has to come down. So again, it's all to manage the metabolism and to boost the quality of the milk. So fenugreek aids in both. And the commonest across India is the Gondke laddu or antinunde, as it is called in Karnataka, which is combined with lots of dry fruits, and it has few seeds in them. For example, the halim or the olive seeds or the actual antu or the bones which goes in, they are very good for the bones as well. They increase the lactation, which is good for the health of the baby. Also, you can have, I mean, if there is a lot of restriction for drinking plain water, you can have decoctions of som for the fennel seeds. It increases the metabolism. Also, it is proven to improve the lactation. So this is getting your body ready for everything. But we also need to see how to take care of the breast, right? Because post delivery, all new moms are given oil bath along with the baby. So when you are taking the oil bath, make sure the breasts are massaged in a circular way. Okay, and the oil again depends on your region, or you can go for any of the medicated oil with a consultation from an Ayurveda doctor, or you can use the traditional oil which is being used from your families from generations. So you have to lukewarm the oil, and it's generally applied throughout the body. Same thing has to be done even in the pregnancy. Keep your breast soft so that as the conditions which were told by Dr. Jyoti earlier, the cracked nipples or the latching issues, that won't happen if you do the Abhyanga properly. But one thing to keep in mind when you are doing this before delivery, you should not stimulate much of the areola or the nipple part. Right, Sandhya ma'am?
Yes.
Yeah, because if you trigger too much of the nipple part and the areola part, that can release an hormone which can stimulate the uterus. So just slightly massage your breast in a circular way as a routine in your bath, probably for 30 seconds to 45 seconds. And post delivery also. And many would be thinking like, should I wipe my breast before feeding? Should I use soap or should I not use soap? Should I use ointment? Should I not use ointment? If you have applied something, kindly wipe it neatly. If you are using something like nip care or any other thing, like if you are dealing with the issues of the cracked or sore nipple, wipe it neatly. You feed the baby, and after feeding the baby also you have to wipe it neatly.
So what about this using butter and ghee for cracked nipples, Manasa?
Butter works really well. You can apply it. I mean, after applying butter or ghee, if you are wearing your clothes, it's ideal again to wipe it before feeding because they keep the breast supple. But I mean, it's ideal to practice from the beginning. When it is too intense, honestly, it will not help so much. When it is intense, it's ideal to if they take the help from the
Doctor.
specialist. Yeah.
Okay. Okay, that's good. So now we have somebody eating very well and producing good amount of milk and, you know, enjoying the breastfeeding process for about 6 months or so. You start going out to public places. How do this, this is a question for Dr. Anu, how to handle breastfeeding in public places? Because that should not be a deterrent, you know, saying I'm going to work, I'm going out shopping, I need to be out for a good part of the day with my baby, sometimes without my baby. How to handle these kind of situations? And at what stage can we start introducing other foods? This question is, I hope Dr. Anu can help us with the answers to these questions.
Yeah, Sandhya, I think these are two situations which every mom encounters and is anxious about. So first, let's come to the problem of feeding in public places. Now, as of now, we know that in India, we are not very breast friendly, I would say, because we do not have public places where the mother can actually comfortably feed and have privacy for herself. Unlike other countries where generally there is a changing area, a feeding room. The only places I have seen in India where these facilities are provided are the malls, where they do have a place where the mother can change the baby's diaper, she can feed, there is a place for that. Other than that, when it comes to public places like the like a beach or a garden or a park, I have hardly seen any place. In fact, even at workplaces, which is the second challenge that every mother faces, because, as doctors, we do motivate the mothers to continue breastfeeding once they get back to work. And at this point of time, 6 months is the mandatory maternity leave that every mom is entitled to. But after 6 months, what happens? They're still continuing to breastfeed, though the baby has been started on other solids. So there are two ways of looking at this problem when the mother is going away for work. The key to this thing is also being prepared for this. So as soon as your baby is close to 5 months of age, it's good to have a talk with your doctor and look for options as to how you are going to maintain breastfeeding in the next few months. So one excellent option is to continue breastfeeding. So mother sometimes may be away for anywhere from 6 to 8 hours when they are at work. So one option is to express breast milk and store it. Now, you don't need any fancy things to store the breast milk. for about 24 hours. Easily, you can do it in your domestic refrigerator. There are, of course, bags which are available, but one storage can be done. I usually recommend mothers to buy these regular steel dabbas that you get outside, which have a good cover and a seal. So they can express. So they can express milk in different quantities, because we do not recommend keeping in the refrigerator, taking it out and thawing it and then putting it back. So when we store for about 24 hours, you don't have to put the milk in the freezer. You have to put it in one of the compartments, in the second or third compartment, keep it completely sealed in a clean container. And when the mother is away, the person who is taking care of the baby can take this out, keep it in a warm water bath, bring it to room temperature, and give this expressed milk by spoon or by Volde or Palada to the baby, till such time that the mother returns from work and she is able to continue breastfeeding directly. Now, the second question is how to express milk. There are two ways it can be done, one manually and the other using a breast pump. There are lots of different kinds of breast pumps available, ranging from manual to electric breast pumps, but it's really important to know how to choose the right breast pump, because otherwise you'll be spending a lot of money and you may not be able to, and the whole process itself may become very painful. So the first thing is to look for the right breast pump, and then definitely talk to your doctor and check which is the right one to buy. Having said that, manual expression is also possible. It depends on your comfort level and how often and how much you're going to express. Now, expressing of breast milk can be done earlier on the previous day, and you can keep storing it for the next day. It's not that you have to express once and use it immediately. So this is the way you can maintain breast milk as well, and the baby doesn't have to be given extra milk when the mom is away, because that's where we give the complementary food. Now, when it comes to complementary feeding, we start this only after the baby completes 6 months. Now, traditionally, most of you would probably know that we have this ceremony of what is called Anna Muhurta or Annaprashan. And typically, it used to be done only after 6 months, because our ancients were very wise. They knew that in the first 6 months, mother's milk is sufficient. It's complete food for the baby. And it is only after 6 months that the baby is actually ready. If you look very closely, at 6 months is the time the baby starts getting excited when you're eating, wants to grab what you're eating. It starts drooling, and then it is food ready. It's ready for solid feeding. And that's the time we introduce complementary feeds. Now, to just put it very briefly, the complementary food that we introduce are all what we are traditionally using in our own house. So the idea is that starting from completion of 6 months till the baby gets to 1 year of age, the food that we introduce is what you eat at home, provided it is healthy. So it has to be from our cereals and pulses that we normally use at home. So in Karnataka, the commonest cereal that we start with is ragi. It varies according to different regions in India, but when it comes to the reason why, ragi is rich in iron and calcium, very easily digested, and it is rich with all kind of nutrients, and one of the most perfect complementary foods for our baby. Rice is also used in certain regions. Banana powder is used. There are different things which are used, but the basic principle is that we start only from the 7th month. We gradually increase the complementary food without compromising on breastfeeding. And after 1 year, the baby is on the family pot. This is the basics of complementary feeding.
Thanks, Anu.
Dr.
Yeah.
Ma'am, I wanted to know, like at many homes, I've heard people telling, oh, you're feeding, that's why the baby is not eating properly. You should cut down the number of the feeds. What's your opinion about this?
I think that's one of the most important questions to answer, because I think there's not one mother who doesn't get to hear this. So I think that is a myth. Breastfeeding does not interfere with introduction of solid feed. So we are, and that's the reason why we call it complementary food. We are not trying to replace breast milk. We are trying to complement breast milk after 6 months, because after that, breast milk alone is not sufficient for the growth of the baby, whether it is about physical, mental development. For this, we need to add complementary foods, but it in no way interferes with breastfeeding.
Yeah. Yeah, that's good to hear. So there are situations when, we need to stop. So the mother continues to feed. Many of them now can feed for 1 year quite well, adequately, adding complementary foods after 6 months. But at some point in time, they want to kind of, you said weaning is not the word to be used now. You take the baby off the breast. And sometimes it happens naturally because the milk production comes down, whatever. But sometimes there is a good flow of milk and we need to stop it. Are there any natural methods of doing this, Manasa? I mean, we have medications to stop breast milk, but we like to use that sparingly. So,
Yeah.
Manasa, are there any Ayurvedic methods of naturally reducing milk flow and stopping breast milk?
Yeah, actually, there is no such medication available which can be given internally to reduce the lactation. But there are few methods which are being followed, and as I think it's generally suggested in every fraternity of the medicine is first thing they have to reduce the number of feeding. It's not like you're feeding 10 times a day and next day abruptly stopping, because that is very uneasy for the baby as well as for the mother. So the number of feeding has to drop down. Once it's dropped down, the consumption of the milk and whatever, like I said earlier, the vegetables and the fruits or the dry fruits, milk and the ghee, which are used abundantly to boost the lactation, they have to be reduced. And you can take the cabbage leaf, freeze it in the freezer, put it inside your brazier like a cup, and that reduces the soreness and also further formation of the milk. And even this in the Folklore practice, this jasmine flower leaves, they are used and they are put inside, which reduces the flow to a minimal extent. So when the extra nourishment is stopped, it reduces a bit. And also when the reflex, it's reduced, like the number of feeding is reduced, the quantity of the lactation, the production of the lactation comes down.
Okay, thanks.
Can I just add one thing to that, Dr. Mansa? I think that was such an important point that, the number of feeds has to come down. So that's the reason why when we talk about, taking the baby off the breast, it's usually at about 1.5 to 2 years. By then, as a natural process, the baby is also sleeping longer hours at night. And the number of feeds in general are reduced to barely 3 or 4. And most of the time, if the baby is waking up very frequently at night and feeding, it's more for self-soothing rather than nutrition. So by 1.5 to 2 years, as a natural process, the number of feeds come down. So, and like you said, if you are feeding frequently, more milk forms. So the first step is to reduce the number of feeds, and which also happens naturally. So that's why that age is kind of the right time to think of stopping breastfeeding.
Yeah. Thank you. Now we move on. I think we've almost come to the end of the session. And few things that as a breast surgeon, I want to highlight upon. We've heard, breastfeeding is by and large, most of the times very enjoyable and very natural and, very soothing to the mother and the baby. But sometimes there are troubles which crop up, which can cause a lot of distress. The most common thing that we see during lactation is mastitis. There's some kind of an inflammation or infection that happens. It can be very focal, restricted to a small area of the breast. It can involve the whole breast. Sometimes there is pus formation, and many times, we may have to aspirate the pus, or in extreme cases, make an incision to drain the pus. And many times, mastitis happens because there is infection going backwards from the nipple. And, the baby may have some candida, some fungal infection in the mouth. And sometimes, just unhygienic practices, which just pay some attention to, hand washing frequently, etc. You don't have to wipe your nipples every time, because that itself will destroy the surface of the nipple. And many times these can be managed with some very conservatively with some antibiotic which your doctor prescribes, and it will usually settle down. There is no reason for you to stop breastfeeding at this time when you're having mastitis, because that will again complicate the issue. It will cause a lot of engorgement. Then the abscess becomes worse and it's quite painful. So when it does become an abscess, again, there'll be signs that you have fever, you have a lot of pain, you're unable to breastfeed. Your breast is not producing enough milk because of the pressure of the pus in the cavity there. So in which case, the doctor may recommend that you have an ultrasound guided aspiration to drain the pus, put you on a proper antibiotic, and depending on the location of the abscess, you can still continue to breastfeed after a gap of 2. That again, your doctor will decide and tell you. There is no reason for you to believe that once you have an abscess, you need to stop breastfeeding. If that is not the case, we've had a lot to feed babies for almost a year after draining of the abscess. So this is about the acute condition which can complicate your breastfeeding process. Now there are other things, there is something called a galactoscele, which is a dilatation of a portion of the milk duct to form something like a small balloon, and it fills up every time the milk flows into it. So sometimes galactoceles may not cause any problem. You can still continue to breastfeed and have no issues. It will just balloon out and then subside. Sometimes when that galactocele becomes infected, again, we need to aspirate it. Very rarely you may have to incise. And you may find that after stopping breastfeeding, the galactocele size reduces to a very small thing. And depending on the nature of that and how big it is, your doctor may advise you to have it removed surgically. There are lots of women who've had small lumps in the breast. They could have been breast cysts, they could have been fibroadenomas, which was noticed, say, when you're early teenage or early 20s or so. And many of them almost never cause any problems unless they're growing in size or, becoming very prominently noticed in a small breast. So we never really interfere with them once we're 100% sure that it is a benign breast lump. And there is no reason that these lumps can also decrease your milk flow. Again, as I said, only depending upon the size and things like that. You can still continue to feed the baby, even if you have been diagnosed with a fibroadenoma earlier, before your pregnancy. And of course, very, 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 very rarely, there could be a cancerous growth in the breast during pregnancy or during lactation. So anything that has appeared new, or if you've had an old breast lump or fibroadenoma which is suddenly increasing in size during pregnancy or breastfeeding, don't hesitate to contact your doctor immediately, because this is something that we don't want to miss. It is very rare. You need not be anxious about it, but you just have to keep it at the back of your mind. But it should not stop you from, worrying. It should not start you worrying about stopping breastfeeding. So any problem, you just have to seek medical advice immediately. So these are a few complications or troubles that you can encounter while breastfeeding. Most of them do not occur in the normal course of things. It's very rarely if you had some infection that can cause mastitis as well.
Sandhya, here I just want to add one thing. This has been my personal experience also, that many of them, maybe whatever, they somehow neglect personal hygiene because they've been told by the old people in the house, you should not have a bath, especially if they've had sections and all that. And so that I feel will contribute a lot to having problems with the breast also.
Yeah, so is it like mastitis is a
Yeah.
lot dependent on personal hygiene also, if it is not related to some systemic infection. Because many times even a cough and a cold can trigger mastitis. Some throat infection, etc., bacterial infection of the throat can trigger infections elsewhere in the body, like a UTI or a mastitis. But by and large, it's important that we pay attention to personal hygiene to prevent these infectious problems. So I think with that, we come to the end of the session. And Anu, would you like to conclude regarding the benefits for both the baby and the mother?
Yeah. So I think this is by far the most important thing for moms and all the family and people who are caring for the mother to understand the importance of breastfeeding. Now here there are two parts. One is the baby and the mother. For the baby, what are the advantages? One are the immediate benefits. One, it's a complete food. So whatever the baby requires for growth, everything is there in it. And it is tailor-made and it is customized. Because for your baby, your breast milk is the best. So that way, there's nothing else which can compare with that. Third, when it comes to immunity. Now, I spoke about colostrum and about the other important nutrients which are part of breast milk. They confer immunity to the baby. Very rarely we will see a breastfed baby landing up with infections. So remember to feed the first few days and continue breastfeeding as long as possible, especially in the first 6 months, do exclusive breastfeeding, because this is going to help build immunity for the baby. Also, there are enough and more studies which indicate that risk of allergies is very, very low, especially in families where there's history of dust allergy, asthma, eczema, etc. For the baby, it is extremely protective if it is breastfed as compared to any other kind of milk that can be given to it. And the surprising thing is that there are many studies which show that babies who have been exclusively breastfed, they score much better on IQ. So for all the moms who are out there or who are expecting a baby, if you want to have a smart baby, then the key is in making sure that the baby is exclusively breastfed in the first 6 months of life. And apart from that, the most important thing is the bonding. So the bonding happens when the baby is with the mother, not when somebody else is taking. You can always find somebody who will feed the baby or take care of the baby, but the bonding happens only when you feed. And the key is in starting breastfeeding at the earliest, soon after delivery. When it comes to long-term benefits for the baby, we have many lifestyle diseases which more and more adults are suffering from, name it, whether it is cancer, diabetes, high blood pressure, obesity. Now, all these things you can reduce. Imagine the kind of benefits you're giving your baby, the long-term benefits. So you're not just giving immediate health benefits, but also long-term benefits and prevention from lifestyle diseases for the baby. Now, mother takes a lot of effort to breastfeed the baby for about 2 years. So I think that's why nature has made sure that even mother is benefited when she breastfeeds. So the immediate benefits of breastfeeding are, of course, first and most important, having that comfort and knowing that she's doing the best for her baby, and what better way to bond with a baby. The second thing is that, like Dr. Manasa said, during pregnancy, you do put on a lot of it, some of which is necessary, but some of it is you want to get back into shape after you have had the baby. So breastfeeding actually does not spoil your figure. It helps you to get back into shape. That's the beauty of breastfeeding. And the third thing is that the uterus, which has expanded to accommodate the baby during pregnancy, when you start breastfeeding, there are certain hormonal changes which are happening within your body, and they actually help the uterus to get back to its original size and shape. This is very important because soon after birth, if you don't feed and if the uterus fails to come back to its original thing, you can land up with a serious complication of bleeding, or what is called postpartum hemorrhage in medical terms. So these are some of the immediate benefits for the mother. And in the long run, mothers who breastfeed Dr. Sandhya, you mentioned about cancer of breast. I think one of the best ways of protecting yourself from breast cancer in future is probably also breastfeeding. Don't you agree?
Yeah.
Is breastfeeding protective for mothers?
Yes, breastfeeding, because the breast tissue and the cells, the ductal cells, reach their maturity only when the mother breastfeeds. Until then, it remains a immature cell. So it's important that it matures so that the chance of cancer is much less.
I think that's such an important thing for all moms out there to understand, because it will motivate you to take care of the baby as well as yourself. And mothers who breastfeed also have lesser chance of the same lifestyle diseases which I spoke about, like obesity, high blood pressure, diabetes, etc. And also, you know that women, as they grow older, they lose a lot of calcium from their body and they suffer from softening of bones. And we often have in middle and older age women landing up with problems which are connected, frequent fractures and so on. So one of the things breastfeeding does is also makes your bone stronger. So you will have lesser risk of a problem which is called osteoporosis or thinning of the bones later in life. So there are many, many more benefits, but this in nutshell are the most important for you and your baby. And I hope this helps you to, feel motivated enough to continue the process.
Yeah, and also, the incidents which you mentioned, the postpartum depression incidents is also
mental health issues.
Yeah, mental health
Yeah.
issues. Also very.
Yeah, I think the benefits are immense. We'll need one whole session to just talk about
Exactly. And basically, to sum it up, I think it's like you said, the bonding, and it's a spiritually elevating experience. This kind of a mother-child relationship is non-existent at any other time on.
I just want to add one more thing. The best thing to improve your lactation is be staying happy and calm. The more you're anxious, the more you're stressed, the milk production comes down.
Absolutely. Yeah. Yeah. So, yeah, thank you. Shall we? I think there are a few questions in the chat box.
Yeah, one person wanted to know how long you can store the expressed milk.
So shall I take that?
Yes, yes, Anu.
So storage of breast milk depends on how long you want to store it. Point number one. So if it is for a few hours, then it can be kept at room temperature outside. If you are going to use this milk immediately in the next few hours, then you can keep it outside in a clean and covered manner. And if you want to store it for about 24 hours, our domestic refrigerator, you do not need to freeze the milk. You can keep it in the second or third compartment and can be easily used for about 24 to 36 hours without any problem. But what is really important to remember is that if you are storing more milk, then please use it in keep it in different containers. Once you have taken the milk out and you have thawed the milk and put it in the warm water bath to feed, please don't keep it back. So don't waste the breast milk. It's very, very precious, every drop. So make sure that you take out one container, use it, and the next feed, the next container can be used, or a bag if you have used that. I hope that answers your question.
Yeah. The next question, Manasa.
Yeah, one of our participants who is a mom of 2 months old baby is concerned about the feeding once she starts working. Ma'am, could you hear?
Yeah, so when are you going to start working? Do you have 6 months maternity leave? So I think we'll just answer that question. It's just like what Dr. Anuradha said. Once you know the technique of expressing, storing the milk, you can still make sure your baby receives breast milk even if you're out to work. Right?
Yeah, and Sandhya, since we have 6 months of maternity leave, it's only in the initial months that you feed almost 12, 13 times every day. But after 6 months, once we start introducing complementary food, the frequency of breastfeeding comes down. And there are two problems there that here we need to solve. One is expressing and giving the milk to the baby when you are not there, and then making sure that the complementary feed, what we are giving, whether it is mashed fruit or a cereal, etc., that is given at a time when you are away at work. So the baby gets enough when you are not there. And second is, if you are at your workplace, since you're feeding, you may get uncomfortable. Again, it depends on the number of hours you are at the office. So do you have a place where you can express the milk and you can store and you can bring it back with you and it can be used? So there are various options available depending on where you work and how much of support system is existing at your workplace. So this is something I would like you to explore, like I said, a little early enough, between 4 to 5 months of age, so you're able to prepare.
Yeah, thanks, Manu. I think we have just one last question about somebody having a premature baby she had a premature baby at 33 weeks, and the doctor suggested to directly breastfeed after he reached 2 kgs. As of now, I only express breast milk 20 to 25 ml every 2 hours. But I'm able to express breast milk only every alternate 2 hours. Is it less? What can I do to increase milk?
Yeah, I think that's a great question. Here, two things. Now, I don't know whether your baby is still 33 weeks or it is already 35, 36 weeks. So it depends on that. Once the baby has reached, is around 35, 36 weeks of age, gestational age, what we say, your baby is perfectly capable of feeding directly. So direct feeds are possible if the baby has reached that. But if the baby is still around 33 weeks, it's not just about the 20-25 ml. Is your baby passing enough urine? Is the baby growing well with the amount of expressed milk that you are giving? It is okay even if alternate feeds you are able to express some 25 ml. But is your baby growing at the rate that it is expected to? These are some of the questions that you need to answer, and you need to check with your pediatrician.
Okay. Thanks, Anu. That's good. So you want to tell them about the boot camp?
Yeah. So can I just quickly share one slide?
Yeah, please do that.
Yeah. So I think you will.
Yeah, make Dr. Anuradha the co-host, Kirti.
So before I share my screen, what I'd like to say to all the moms out there is that pregnancy and the first 2 to 3 years of life are very important for the mother as well as the baby. And this is the time of life where the baby grows at its fastest in terms of physical and mental growth, and connections are forming. And hence, the way we parent, the way we take care of our babies makes a huge difference, because we are laying the foundation for future health of our babies. And that's the reason I have seen that most mothers, they are so busy taking care of their babies that self-care somewhere takes a backseat in the entire process. And we know, like Dr. Manasa said, if the mother is happy, calm, and content and confident and is aware of what she's supposed to do, you have the obvious result in front of you in the form of a confident and happy kid. And that's the reason anything that we do for the baby, the mother always comes first. But unfortunately, we always don't give ourselves the priority that we need. And in that regard, what I'd like to share with you is that I'm doing a 5-day self-care boot camp for moms. And this is for moms who are expecting a baby or who have new moms. It is a 5-day online workshop that I do every month. And it's for a period of 5 days where we are trying to understand what are the self-care challenges moms are going through, and then helping them to take small action steps throughout these 5 days. And then at the end of the workshop, what I teach you is what are the 3 secrets that every mom needs to know to be highly confident. So if any of you as participants think that this is something that is going to help you, then I would like you to get in touch with us. The phone number is given below. And I'll be doing one boot camp tomorrow, but there the slots are already full, but we are going to have it in another couple of weeks. So anyone who is interested and who feels they'll benefit from this, please note down this number. It's 97421 7060600. And I would love to have you in this camp if you are a committed mom. So thank you for allowing me to share that.
Thank you, Anu. Yeah, so we are always there. You can reach out to us for any breast health issues, be it, difficulty in breastfeeding or some problems with the breast, cracked nipples, mastitis, how to improve the flat or the inverted nipples, etc. Any doubts that you are having, you can always reach out to us, either at Prameya or TOTS 2 teams, and we are all there to help all of you. So thank you for logging in and participating. Thank you, Anu. Really nice that you were able to answer all their questions and give us so much insight and information. Thanks, Manasa. And we hope we have a problem-free lactation period for all the moms around here.
Yeah.
Yeah, and also a very happy Women's Day to all the women over here in advance. So prioritize yourself every day, not just on one particular month or 1 week.
Absolutely. Absolutely. Take care of yourself and do everything successfully, not just breastfeeding. Take care of yourself. Yeah.
We'll be sharing a feedback form on WhatsApp or mail, I think, whatever you've given contact. So please send us your feedback on this, and also any other topics that you would like us to discuss in such a way in the later sessions, you can let us.
Thank you.
Thank you. Bye-bye.
Bye. Bye. Thank you.
Bye.